first of all, I want to sit here and congratulate Dr. Prashant. I really do. He has taken the time, just so you all know, to come to the United States. And he came to my hospital in the United States to train on this technology, so that when he came back home here to India and did his first surgery at Specialist Hospital, that he felt comfortable with this new technology. So for him to make that extra effort, he and I got to meet in the United States, and then I was invited back here to work with him today. That was a privilege for both of us, really, to be able to collaborate together with this new technology. And he is certainly one of the leading surgeons in India who is looking at this technology and saying, how can I use new technology to help my patients?
So we've started this robotic surgeries for knee replacement, and this is the first time in Karnataka what we're doing robotic surgeries with, for knee replacement. The advantages of this surgery is, patient is very comfortable and post-surgery, less pain, we take out less bone loss, and the stay in the hospital is very less, and they're back to the knees, getting back to the work very faster. So these are the advantages of robotics, where with robotic technology we take out the precise amount of bone accurately and precisely, so that we replace it with an implant. This is different from regular surgeries where you would have heard about robotic surgeries in urology, where most of the time they take out the diseased tissues, but with in orthopedics where we take out the tissues and we replace it with metal. So the success rates of this operation is very, very good, and my patients are all happy with this technology. Cost effective. And it is very cost effective. We don't charge more for the patients. It's the same according to regular replacement.
I'm honored to be invited to come here to Bangalore to work with Dr. Mukesh as far as the new robotic assisted technology that he has available in his operating room theater. The success rate of knee replacement surgery is what we're trying to improve upon. It's a successful operation, but we know that there are some patients who are not satisfied with their operation, and what we're trying to do is help the Indian people, just like we help the people back in the United States, in my practice, use this new technology to get the best outcome, to improve the success rate, and ultimately, if they're happy with their new knee, as we like to call it, then we have done our job well, and that's what robotic assisted technology is really trying to do.
Thank you. Ashalata, ನಾವು ಶ್ರೀನಗರ ಇರೋದು. 1 year ಸ್ವಲ್ಪ ನೋವಿತ್ತು, ನೀ ಪೇನ್ ಇತ್ತು. ಅವರು ಟ್ಯಾಬ್ಲೆಟ್ನಲ್ಲೇ ಹೋಗಬಹುದು ಅಂತ ರಿಕ್ವೆಸ್ಟ್ ಮಾಡಿದರು, ಬಟ್ ಅದು ಆಗಲಿಲ್ಲ. ಮೇನಲ್ಲಿ ತುಂಬ ಜಾಸ್ತಿ ಆಗೋಯಿತು. ಆವಾಗ ಹೋಗಿ ನೋಡಿ ತೋರಿಸಿದ ತಕ್ಷಣ ಅವ್ರು ಹೇಳಿದರು ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಬೇಕು ಅಂತ. ಸ್ವಲ್ಪ ಹೆದರಿಕೆ ಇತ್ತು ಹೆಂಗಂತ. ಆಮೇಲೆ ಎಲ್ಲರೂ ನಮ್ಮ ಮನೇಲಿ ಕನ್ವಿನ್ಸ್ ಮಾಡಿದ್ರು, ಇಲ್ಲ ಸರಿ ಹೋಗುತ್ತೆ, ನೀವು ಹೋಗಿ ಮಾಡ್ಕೊಳ್ಳಿ, ಎಷ್ಟು ಬೇಗ ಆಗುತ್ತೋ ಅಷ್ಟು ಬೇಗ ಮಾಡ್ಕೊಂಡ್ರೇ ನಿಮಗೆ ವಾಸಿ ಆಗುತ್ತೆ ಅಂತ ಹೇಳಿ ಎಲ್ಲರೂ ಕನ್ವಿನ್ಸ್ ಮಾಡಿದರು. ಆಮೇಲೆ ಓಕೆ ಅಂತ ಸರ್ಜರಿಗೆ ಇವಾಗ ಚೆನ್ನಾಗಿ ನಡೀತಾ ಇದ್ದೀನಿ. ವಾಕಿಂಗ್ ಎಲ್ಲ ಹೋಗ್ತಾ ಇದ್ದೀನಿ, ಸ್ಟೆಪ್ಸ್ ಹತ್ತೋದು ಇಳಿಯೋದೆಲ್ಲ ಆಗ್ತಾ ಇದೆ. ಇವಾಗ ತೊಂದರೆ ಏನಿಲ್ಲ.
My mother S. Padmavati, she's 66 years old, and she's suffered knee pain for more years, and normal activities has been a little problem. So she came to me, and we opted a specialist hospital, Dr. Prashant, who has taken care of her, and we stayed in hospital for only 4 days, and within 4 days, after going home, immediately she didn't use walker. She started helping me in all her activities, household activities, and with now 15 days finished, and she's quite normal. And doctor and robotic surgery, everyone should opt, and it's easy and less painful, no minimum blood loss. I think seeing my mother, I think I'm very happy with Dr. Prashant treatment.